sir. My name is Sydney. I'm a nursing student. Can you please tell me your name and date of birth? Alright, thank you, sir. I was looking in your chart, and I noticed that the doctor ordered an NG tube. Do you know what an NG tube is?
Nope.
Okay, so basically an NG tube is a tube that will stick into your nostril, it'll go back to your throat, and it'll go into your stomach and to pump out the stomach contents into this container over here. Do you have any other questions about the bedside procedure?
Nope.
Okay, so do you have an allergy to latex or anything else that you know of?
Yes, latex.
Okay, I'll be sure to grab some latex-free gloves for myself, and I would assess for all contraindications, and no contraindications were observed. So I'm going to go ahead and I'm going to go get the supplies, and I'll be back in a second. So I would leave and come back, and I would wash my hands to provide privacy. Alright, sir, so I'm just going to check your armband again. Can you please tell me your name and date of birth? Alright, thank you. So I'm going to raise your bed to a working height. Alright, there we go. So I'm going to go ahead and put on my gloves. So I'm going to put this chuck across your chest. And we're going to go ahead and measure the tube before insertion, just to make sure that it's long enough to get into your stomach. So we're going to measure from the tip of your nose to your earlobe, and that's about 15 centimeters, and then we're going to go down to your xiphoid process, which is in your chest, and that is 50 centimeters. So we'll insert the tube 50 centimeters. So I'm going to go ahead and spray some lubricant. Get that lubricating. I'm going to place this here. I would give him a glass of water to hold, but we're just going to stick the straw in his mouth. Alright, and so I've already taken out my pH stick, and my tape is ready on the side of the table. I'm going to get that all lubricated. Alright, so we're going to go ahead and insert it. So can you look up for me? Alright, and thank you. We're in 15 centimeters. So now I'm going to have you put your chin to your chest, and we're going to go the rest of the way, okay? Chin to your chest. Alright, now start swallowing that water for me. Swallow, swallow, swallow. Keep swallowing until we get it all the way in, okay? It'll go down easier. So we're almost there, almost there. Swallow, 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 and we're in. Awesome, thank you. So I'm going to hold that so it doesn't move, and tape it, secure it to keep it from moving around. So I would call X-ray to have them come and check to make sure that the tube is in the right location. X-ray has come and said that the tube is in his stomach, so I'm going to go ahead and pump out some of the contents. A little bit in my syringe. Close that back up. And I would drop this onto the pH stick. Alright. And by the color on the pH stick, the pH level in his stomach is 3, which is within normal range, so that's good. And so I'm going to go ahead and hook you up to the suction. So I'm going to turn the suction on. I would lower his bed, put his call light in reach, and ask if he needed anything else. If he says no, I would go ahead and leave the room. So a few days later, knock, knock, knock. Hello, sir. I'm Sydney. I'm a student nurse, and the doctor has ordered for your NG tube to be removed. Can you please tell me your name and date of birth? Alright, thank you. So I noticed that the tube is still straight out his nose at 50 centimeters. So I'm going to go ahead and turn the suction off, disconnect it from, and quickly put that back on. Alright, so I'm going to get some paper towels ready. So I'm going to take the tape off. Alright, just breathe normally for me, okay? And upon exhale, I would remove it in one fluid motion. Wrap everything up in the chuck. Wipe his nose for you. get him anything that he needed, if he needed some water, anything like that. I would lower his bed. Place his call out in reach and ask if he needed anything else. And if he denied any further needs, I would leave the room.